Okay. Well, good morning, everyone. Welcome to today's very important announcement. My name is Trisha Estabrooks, and I'm proud to be the candidate for the NDP here in the heart of Edmonton Centre. That's right, friends. Before we get underway with today's important announcement, I want to take a moment to acknowledge that we are all gathered here on Treaty 6 territory and within the Métis homelands of the Métis Nation of Alberta Region 4. This land, for time immemorial and for many, many generations, has been home and a traditional territory and gathering place of many Indigenous people, including the Nehiawa, Dene, Nakota Sioux, Saulteaux, and Blackfoot. And so today, as settlers and guests, we must commit ourselves to ongoing reconciliation, as well as justice and respectful relations going forward. I'm also really pleased to be joined by a number of candidates representing the NDP here in our city today. I'd like to introduce Leslie Thompson, Sean McQuillan, MP for Edmonton Strathcona, Heather McPherson, Blake Desjardins at the back, my friends. We also have Susan Cake, Madeline Mays, and Harpreet. Wonderful, Harpreet Grewal. Thank you all for joining us here today. And the thing is about NDP candidates is that we share such a strong commitment to protecting and also defending our public healthcare system. Healthcare must remain public. It must remain accessible and equitable, not a privilege reserved for just only those who can pay. And that's something we hear all the time as candidates knocking on doors, connecting with people, is that we want a strong public health care system in this country, not one that is under threat of privatization. That's right. So to help us highlight just what's at stake if we don't fight for our healthcare system as New Democrats, I'd like to introduce Penny. Penny Coates grew up in the United States and truly knows firsthand the struggles of privatized healthcare. So please, let's welcome Penny.
Thank you, Trisha. When I was asked to do this, I thought, well, where do I begin? How do I cover this? Because it's big for me. And being the healthcare is no small part of how happy I am to be Canadian now. I've been here a long time. I've been here 60 years. I came in 65. I grew up in the Midwest. And when I came, I was just 23. So I've been here 60 years. And I don't think I've paid one doctor bill since I got here, not one. And I've done, yeah. And as I got older, I definitely needed the healthcare system a few times. My American relatives, you know, when I would speak to them about this, they would be sort of like, I mean, sometimes they told me I was a victim of propaganda, but, you know, they just couldn't believe that no bills, no paperwork. That's another thing. Sometimes they have coverage, but it entails a lot of paperwork, and I think that's not much fun. So it took about 10 years for me to come to a very quiet, subtle realization that good universal public health care provides a peace of mind. And you not only have it for yourself, but you have it for everyone. It isn't just you, and you realize everyone is having that. It's a very nice feeling to have in your country. The other thing that I think provides some of that peace of mind would be that we have very good quality healthcare here, and that's also providing peace of mind. And I have experienced that. I had breast cancer, and that would have cost me, depending on how much coverage I had, more than $20,000, probably as much as $50,000 or $60,000, which is a lot of money. Then my husband lost his battle with cancer. One of the really excellent things he had, including very good medical care, was he had very excellent hospice care. Again, no bills, nothing. Okay, so he was really well looked after. So we don't want to lose our universal public health care. It is a solid foundation for, I think, a very strong country. It makes us all have peace of mind. So I think that would be about covering my feelings about the healthcare system, so I will turn it back to Trish, I think. Yeah, okay.
Thanks so much,
Thank you.
Thank you.
Thank you, Penny, and so proud that you are Canadian, and I really enjoyed your words around the peace of mind, because that's what I think a lot of Canadians count on, is that they can go to the doctor, they can access our healthcare system, and have that peace of mind. So thank you again for sharing your personal stories, your experiences, and again reminding us it's what is at stake. I think the story also highlights exactly why protecting and defending our public healthcare system matters so deeply, not just for those of us who are gathered here today, NDP candidates who are fighting hard right now, but for Canadians across the country. And so now it is my absolute privilege to introduce someone who understands this fight better than anyone else. A leader who is absolutely dedicated to standing up for people, for fairness, and for healthcare. A leader who is in this fight for Canadians. Please welcome Leader of the NDP, Jagmeet Singh.
Thanks so much, Trisha. Well, thank you so much, Trisha. Thank you to the great folks behind me, healthcare workers and candidates, and thank you to Penny for sharing her story. Her story is very powerful. She has the ability to talk in truth about what's going on in the States and what goes on with her family members who have to pay out of pocket, who have to worry about whether they're going to get covered or not, and the difference of what it means to have a universal public healthcare system here in Canada. And the reason why we wanted to share Penny's story today is because our healthcare system is under attack. We are in a deep crisis. The healthcare that we have today is not something that happened by chance. We had to fight for it. Tommy Douglas fought tooth and nail with Canadians to say everyone in our country deserves the best quality care. It shouldn't matter how much you earn or what's in your bank account. Everybody should get the best quality care. That was the dream of Tommy Douglas. And it is a fundamental part of what Canadians are proud of. When we say we are going to fight back against Donald Trump, we'll never be the 51st state. A part of what we're saying is we want to take care of each other. We believe in the Canadian value that we look after our neighbor. And what epitomizes that more than a universal public health care that says that everyone's going to have that peace of mind that Penny talked about? I think about my own family. My dad struggled with an illness, and he struggled with an addiction, and he would not be here today but for the fact that there was a publicly funded rehab center, a part of our public healthcare system, that saved his life. My dad is here today because of that. And the reason why I'm bringing up the attack on our healthcare, we're seeing an Americanization of our healthcare system and a privatization of our healthcare system happening right now in our country. And then on top of that, we have the threats of Donald Trump. In the last negotiations with Donald Trump, he attacked our healthcare system by going after medication prices. He was concerned that we had some protections in place to keep medications more affordable, and he wanted that to be destroyed. And so it is clear to me that he's not going to stop there. He's not going to stop at medication. He's going to come after our public healthcare system because there's profit to be made. And from the beginning, Tommy Douglas said, when we fought to bring in healthcare, that there would be vultures circling, trying to find ways to profit off the pain of Canadians. There would be people that saw people in pain and suffering and say, you know what? That's not someone that needs care. That's a dollar sign. That's money to be made. We reject that entirely. We reject that notion that you should make money off the pain of Canadians. We believe that you should care for Canadians. That's what New Democrats believe in. So we are seeing, this is ground zero. You know, I talked about how we have to fight to bring in healthcare. We have to fight to defend it. Right now in Alberta is ground zero for the privatization of healthcare, for the cuts to healthcare, for the Americanization of healthcare. It's happening right here in Alberta with a Conservative Premier, Danielle Smith. We're seeing it happen right now. And so what are the options for Canadians who are saying, you know, I don't want that. for Albertans who are saying, I reject that conservative approach to sell off our healthcare system. I want to keep it public. Well, we look at Mark Carney. He said, sadly, that he's willing to do a tax cut for millionaires and to pay for it by cutting services. What's going to be on the cutting block? He said that he's going to cut operating budgets. Liberals themselves have said that means cutting services. That means cuts. Well, what he's going to cut? Our healthcare? He's going to cut pensions? What services are you going to cut? We know that Pierre Poilievre has made it very clear that he is in the same line of other conservatives who wants to cut healthcare, cut our services to give bigger tax breaks to the billionaires. That is wrong. So we got Mark Carney, who's not going to stand up and defend our healthcare. We know that Pierre Poilievre is going to accelerate selling it off and privatizing it. So who's going to stand up for you and your family to ensure that healthcare is never on the negotiating table, that we defend our public universal healthcare? That's New Democrats. So that's why I'm announcing today our plan to fight back against privatization. It's a real threat, and we've got to fight back against it. We've got to fight back against the threat of Donald Trump as well. So here's our plan to fight back. First and foremost, universal public health care will never be on the negotiating table with New Democrats in Ottawa. We will never let that happen. Never. Never let that happen. We are also going to ban U.S. companies from buying any healthcare facility in our country. Hands off our country. Hands off. And we're going to do something that the Liberals, and Mark Carney's a part of the same tradition, sadly, that they were not able to and they didn't desire to enforce the Canada Health Act. We've got a strong law that says you can't privatize. You can't have cash for care. But they haven't used that. We are going to enforce the Canada Health Act to end privatization in our country. And finally, we know in this difficult time when folks are really worried about the threats to our healthcare system, I want Canadians to know that we are going to fight with every ounce of our being, with every fiber of our being, to keep our healthcare system not just universal and public, but also to strengthen it, to improve it, because Canadians are worried that the care that they need is taking so long. So my commitment to you as a New Democrats, you elect New Democrats, we're going to go to Ottawa and fight to make sure our healthcare system is stronger, that you can get the care you need faster. We're going to be there for you. So in this difficult time, I also want to take a moment to reflect on the fact that we've got incredible healthcare workers behind me. These are incredible champions, frontline healthcare workers, and they are led by the president of QP Alberta, Raj Uppal, recently elected as the president. So round of applause for Raj. I'm gonna invite the president of QP Alberta to say some words in relation to the plight that our healthcare system's up against and the plight that workers are up against. Raj, so honored to have you here. Please take the stage.
Hello, everyone. So here in Alberta, we're proud Canadians. And in Canada, we believe that healthcare should be based on your needs, not on the size of your wallet. Public healthcare is a core part of who we are, and it's something that we're proud of. But right now, it's under attack. The UCP government is pushing for more and more privatization into our healthcare system, funneling public dollars into private clinics that then turn around and charge Albertans as out of pocket. It's triple dipping. Taxpayer dollars money, weakening public services, and making people pay more. And we know exactly where this road leads us. Longer wait times, staff shortages, two-tier systems where the rich jump the line to the front and everyone else is left behind. Let's talk about the UCP's restructuring. Actually, that has anything done for Albertans. Layoffs, ER closures, chronic understaffing, none of it has actually improved any care for Albertans. As a healthcare worker myself, I have seen firsthand how it has created chaos, driven healthcare workers away, and put more strain on the already breaking system. And the UCP isn't fixing our healthcare. They are tearing it apart. So what do we know that has always, who do we know that has always fought to protect public health care? It's the unions.
That's right.
The nurses, the paramedics, and the hospital staff who keep our systems running are on the front lines of this fight. Our union have been standing up to privatization, fighting for safer working conditions and demanding fair wages so that we can keep the skilled workers in our hospitals instead of driving them away. When we stand with healthcare workers, we are standing up for a system that puts patients over profits. And that's why And that is why, my friends, we are so grateful for today's announcement from Canada's NDP. While Conservatives across the country keep trying to dismantle healthcare, Jagmeet and the NDP are fighting to strengthen the system. Pushing for better wages, for better access, more staff, and real investment in public health is why we support Jagmeet, because he stands with working people, with patients, and with healthcare professionals who keep us safe. Our healthcare should never be for sale. It's time to fight back and protect the system that make us to be the proud Canadian we are. Thank you.
Thank you so much. Thank you to the president of CUPE Alberta. Thank you for your powerful words. And I love the fact you said patience over profits. And our Canadian healthcare system is not for sale and will never be for sale. New Democrats will ensure that. In closing, I want to point out just a couple last things. One is we also heard recently from Mark Carney that he said he would not expand pharmacare. And we're not surprised by that. I don't think anyone should be surprised by that, because the Liberals would have never brought in pharmacare but for New Democrats fighting for it and forcing them to do it. And it shows you again that the Liberals are not committed to healthcare. They're not committed to pharmacare. They're not going to expand it. If you believe in a universal public healthcare system, vote NDP. If you believe in expanding our healthcare, including pharmacare, vote NDP. If you believe in this, vote NDP. Donc, c'est clair qu'on est dans une crise de soins de santé. C'est une crise partout au pays. Et on a des menaces de Donald Trump. Il a déjà menacé notre système pour les médicaments. Le fait qu'on a un système qui réduit le coût des médicaments moins que les coûts aux États-Unis. Donc, il s'attaquait à ce programme dans les dernières négociations. Donc, c'est clair pour moi qu'il va continuer cette attaque contre notre système de santé et s'il va cibler le fait qu'il peut gagner des profits dans notre système de santé public. Donc, je sais qu'il va attaquer notre système public et universel. Donc, on est dans une crise. Et je veux rappeler qu'on a réussi d'avoir un système de santé universel et public avec une bataille. C'était une lutte. On s'est battu pour réaliser ça. Les néo-démocrates, notre premier chef, Tommy Douglas, et les Canadiens ensemble se sont battus pour réaliser les soins de santé universels et publics. C'était une bataille et Tommy Douglas a dit qu'on va avoir besoin de défendre ce système contre des attaques. Parce qu'on sait qu'on va avoir des attaques. Il y a des gens qui pensent qu'il y a des profits quand ils voient la douleur des gens, quand ils voient les gens avec les maladies, ils regardent ces gens et pensent qu'on peut faire des profits. Donc, c'était toujours une bataille. Et c'était toujours les néo-démocrates qui se sont défendus, qui se sont battus pour défendre ce programme, cette valeur. Et c'est une valeur vraiment canadienne, une valeur qu'on doit prendre soin les uns des autres. Et les soins de santé représente cette valeur. Cette valeur de prendre soin des uns des autres, c'est une croissance profonde pour nous. Donc, dans cette crise où on a des attaques contre notre système de santé et la menace de Donald Trump, on a besoin de quelqu'un qui est de votre bord, qui va protéger vos valeurs. Ce n'est pas Mark Carney et ce n'est pas Pierre Poilievre. Mark Carney a déjà dit, pour donner des coupures d'impôts pour les millionnaires, il est prêt de couper les services. Il a dit ça, les libéraux eux-mêmes ont admis que oui, ça va prendre des coupures pour réaliser ce qu'il veut faire. Et Pierre Poilievre et les conservateurs ont déjà montré, leur plan c'est de couper les soins de santé. Coupez les soins de santé, coupez vos services pour donner des gros cadeaux aux milliardaires et grandes entreprises. Et ici en Alberta, les gens savent les attaques contre notre système de santé. Vous avez senti ça, vous avez vécu ça avec les attaques des conservateurs de Daniel Smith, le Premier ministre, comment il attaque le système de santé, privatise le système, vend le système, et vous avez senti les impacts. Comment ça nuit aux efforts d'avoir accès aux soins de santé. Donc, c'est important dans ce moment d'être prêt de défendre notre système de santé, de défendre nos valeurs. Et on est le seul parti qui est prêt de le faire. Le NPD est le seul parti qui est prêt de défendre notre système de santé universel et public. Et Mark Carney vient de dire qu'il ne va pas augmenter ou accroître le système d'assurance médicaments parce que ce n'est pas surprenant. Les libéraux n'auraient jamais fait ça. C'était les néo-démocrates qui ont forcé le gouvernement de le faire. Et si vous voulez une croissance, qu'on augmente l'assurance médicaments, vous avez besoin des NPD. Les libéraux ne vont jamais le faire. Vous avez besoin des NPD qui vont augmenter ce système. Et finalement, j'ai un message que je veux livrer directement au Premier ministre Legault. Je veux être un partenaire pour le Québec. Je veux être un allié pour le Québec. Mais un bon allié, un bon partenaire aussi dit quand ça ne marche pas. Ce n'est pas le temps de couper dans les soins de santé. Ce n'est pas le temps de privatiser notre système de santé. Et c'est clair qu'à ce moment, on doit renforcer notre système. La privatisation ne fonctionne pas, ça ne marche pas. On va renforcer la loi canadienne sur la santé, on va arrêter la privatisation, on va travailler ensemble avec les Québécois et Québécoises pour mieux bâtir un système de santé qui est là pour vous, qui est public, qui est universel, qui est gratuit. Et un bon partenaire, le Canada doit faire sa part, c'est clair. Mais Premier ministre Legault, vous ne pouvez pas continuer avec la privatisation parce que ça fait mal aux gens au Québec. Merci. With that, I'm ready to go to any questions you might have.
Merci beaucoup. On va maintenant passer à la période de questions. Une question et une relance par journaliste. We'll now take the questions from the press. One question, one follow-up. We'll begin with Rachel at Yellow CTV.
Good morning, everyone. Just specifically on today's announcement, can you be explicit and clarify how you intend to jurisdictionally, legally move forward with this promise to ban American corporations from buying up Canadian facilities?
Yeah, so there's lots of ways we can put in place those type of protections. This is similar to how you defend a country against foreign takeovers when there's increased inflation, when there's our dollar is depressed. There's also the same desire that companies want to come in and buy up our companies. Foreign companies look at opportunities to buy up Canada. In those circumstances, there's laws we can put in place to protect us against foreign takeovers, to keep Canadian businesses Canadian. So similarly, when it comes to our healthcare assets, I'm saying I'm going to put in place protections to ensure that foreign companies, particularly American companies in this case, can't come in and buy up our healthcare assets. Souvent, les pays qui sont menacés par des entreprises étrangères qui veulent acheter les compagnies ou les entreprises au Canada, on met en place des protections pour arrêter ça, des lois et des règles qui protègent nos entreprises canadiennes. Et je vais faire la même chose pour garantir qu'on n'accepte pas, on ne permet pas des entreprises des États-Unis d'acheter nos établissements de soins de santé canadiens.
And as a follow-up, both the Liberals and Conservatives have now had candidate controversies. Has the NDP had to drop any candidates so far in this race? And what do you make of how Carney and Poilievre handled their respective situations?
So far, we have not had any circumstances, which is, but you know, if things arise, though, we will make the best decision for our country, for our democracy, and so we'll be prepared to do that. I think with respect to Mark Carney, though, it was clearly a failure of leadership. What his candidate did was egregious, and it was to embolden foreign interference is basically what his candidate did. And instead of taking a strong position of leadership to say that is wrong, someone that is going to encourage foreign interference, intimidation, and harassment of Canadians, a reality that many Canadians, far too many Canadians, are living with, the threat of foreign interference or intimidation, threats of violence. Instead of saying, I'm going to stand up and say that is wrong, he failed to show leadership. And I think that was a failure in that case. With respect to Pierre Poilievre, I'm not as aware of the details. I know that he removed a candidate. That candidate said things that were clearly wrong and should have been removed.
Thank you. Now we'll take
Oui. Je pense, donc, on n'avait pas eu des problèmes avec nos candidats jusqu'à ce moment. Si un problème arrive, je vais prendre une décision qui est bon pour le Canada, qui est bon pour notre démocratie. Avec la décision de Mark Carney, je peux dire que c'était un échec de leadership parce que ce que son candidat a fait était quelque chose tellement grave. Il a en effet encouragé l'ingérence étrangère. Et Mark Carney aurait pu dire, je suis contre des ingérences étrangères. Je veux défendre les Canadiens qui font face à cette ingérence dans leur vie, qui font face à l'intimidation, de harcèlement, des menaces de violence, mais il a manqué l'opportunité de faire ça, l'occasion de faire ça, il a échoué sa responsabilité. Avec la décision de Pierre Poilievre, ce que son candidat a fait était aussi grave. C'était la bonne chose à faire de le jeter dehors du parti. Je ne sais pas tous les détails, comment il a fait, donc je ne parle plus de ça.
Merci. Now Janice McGregor, CBC.
Good morning. Canadians don't use online services like Maple or go to private clinics because they want to betray Canada's Medicare system. They go there because their healthcare needs are not being met. Their quality of life is impacted because of the state of the healthcare system in the province where they reside. You're a federal leader. Administering those provincial systems is not Ottawa's job. But if from Ottawa comes a ban on some of these services, aren't you just telling Canadians that they have to be satisfied with a lower quality of life here, that they can't have what they need to be healthy, and that they have to leave the country to get services like that? If you ban it, but the provinces haven't provided a better, healthier, more robust public system, you're leaving people with no options.
Not at all. That's not the approach that we're taking at all. People should be able to access healthcare online. People should be able to access healthcare with telecommunication services. But they shouldn't have to pay for that. That's the problem. They shouldn't have to be charged for it. That's the issue. We don't want Canadians to be charged for this. We don't want people profiting off of them. We want to make access of the services. People live in rural communities, need to use different ways to get in touch with their healthcare provider. We need to rely on technology sometimes. We have to be able to access people in different communities in ways that they can actually get quicker access to healthcare. But they shouldn't be charged for it. And this is the problem with a private cash for care approach. It means people end up paying out of pocket. It means if you can pay more money, you get more services. And then it sets up a two-tier system. And we know what that's like in America. This is the Americanization of our healthcare system that we don't want. This is what Penny is warning us about. What happens in America, when you get sick, you end up going bankrupt. When you get sick in Canada, you get care. You might have to worry about a parking ticket at the hospital, but you're not going to worry about getting the care that you need. And we got to improve that as well, but we got to fix our healthcare system. But that doesn't mean allowing people to get charged. It doesn't mean that if you got a deeper pocket, you get better care. That is the exact opposite of the dream of our Canadian healthcare system. And we got to fight back against that.
April 1st is the end of the federal carbon tax, something New Democrats support. But what's to stop oil and gas companies, for example, the price at the pump? What proof do you have that that's going to actually go down now? If I'm running a gas company, couldn't I say, well, the market has proven they're willing to pay a higher price and just take more profit in the space that used to be the carbon tax available as public revenues? What proof do you have that things get more affordable after today?
This is a great question. This is why we've been saying for a long time, price gouging is a major problem. When the cost of living continues to rise, we're seeing it's because of price gouging. We're seeing more and more when it comes to groceries, the cost of your gas, the cost of your oil. It is huge companies that say, you know what, I can actually make more money off these folks. I can squeeze them for more. We see it all the time when it comes to the winter gas and the summer gas. There's no justification for that. But oil and gas companies jack up the cost of your gas massively every time they switch gas. And it's actually not a cost to them that's justified. They just do it because they know they can actually get more money out of you. So this is exactly what we're saying to Canadians. Let's watch very closely and see if these oil and gas companies jack up prices now, because prices should come down by removing it. But what we've said from the beginning is unless we put in place protections for Canadians against price gouging, big corporations are always going to find a way to make more and more money off your backs. That's why you need New Democrats to fight back. We're the only party that says we've got to stop price gouging. We've got to stop these companies from ripping you off. We've got to put in place more protections for you.
Thank you. Maintenant, on va prendre la question de Juliane Lapointe, Radio-Canada.
Bonjour, Monsieur Singh.
Bonjour.
L'administration américaine dit que la loi 96, c'est une barrière au commerce au Canada. Est-ce que vous vous engageriez à protéger la loi dans le cadre de négociations avec les États-Unis?
Absolument. Et j'ai dit ça dans le passé, dans les dernières semaines, j'ai dit que j'ai des inquiétudes que Donald Trump va attaquer la culture québécoise, la langue française au Québec. Je savais ça. Et maintenant, il a dit clairement. Et ça, c'est quelque chose que on est peur de ça. Et maintenant, on a aussi des inquiétudes avec Mark Carney qui dit qu'il veut contester la loi 96. Et moi, j'ai dit que je pense que c'est une bonne chose. Je suis pour la loi 96 pour défendre la langue française au Québec. Donc, avec les néo-démocrates, si vous voulez quelqu'un qui est vraiment un allié, qui va dire la langue française, la culture québécoise, va jamais être sous la table de négociation, ça c'est le NPD qui va le faire. We have said before that Donald Trump was going to attack the French language and Quebec culture. I said that earlier in the past week, that this is something I'm worried about. And now he's come out directly and said it. He's going to attack the French language in Quebec. We also have Mark Carney, who said that he is, I think he's been a bit flip-flop on this, but he said he's opposed to Bill 96. I've said Bill 96 is about protecting French language, and I support it. And so if you want someone that's going to stand up and defend your language rights in Quebec, New Democrats are committed to doing that.
Vous avez lancé un message à M. Legault en sachant que la santé, c'est un champ de compétences provinciales. Jusqu'où iriez-vous pour faire comprendre au Québec que vous n'êtes pas d'accord avec une décision? Est-ce que c'est correct de s'immiscer comme ça dans un champ de compétences provinciales, comme la santé?
On a une loi canadienne sur la santé, une loi qui établit des principes. Et un de ces principes, quelques-uns de ces principes, c'est notre système de santé doit être universel et public. Donc, je vais enforcer cette loi canadienne parce que je pense que les Québécois et Québécoises n'aiment pas le fait que l'argent public va dans les poches des entreprises privées au lieu de soigner les gens. Et on sait les résultats de ça. Quand on donne plus d'argent aux entreprises privées, ça nuit à notre système de santé. Ça nuit aux qualités de soins. Et on a vu ça à plusieurs reprises. On a beaucoup de preuves qui montrent avec les soins privés, c'est moins de soins pour les gens. C'est plus d'argent dans les poches des grandes entreprises, moins de soins pour vous et votre famille. Et comme un bon allié, comme un bon partenaire, je vais travailler ensemble avec le Québec, mais je vais aussi dire quand ça ne marche pas. Je ne vais pas rester les bras croisés quand on fait quelque chose qui fait mal aux Québécois et Québécoises. Et la privatisation fait mal aux Québécois et Québécoises. Sure, yeah. We have a law, the Canada Health Act, that establishes principles that we believe in when it comes to healthcare. And some of those principles include universal care and public care. And I want to be a good ally with all provinces and with the province of Quebec. But being a good ally and being a good partner also means calling someone out when something's not working. And we know that private care, privatization is bad for healthcare. Private care means more money in the pockets of a big corporation, but means worse care for people. And we've seen many examples of that. We've seen it in long-term care, where private healthcare, where private delivery of care had the worst outcomes, and public and not-for-profit had much better outcomes. We know that private care is great for a CEO, it's bad for people. And so I'm going to enforce the Canada Health Act and ensure that we're delivering public care. I believe the people of Quebec don't want to see their public money, their hard-earned money going to a private company. They want to see it going to the best quality care for the people that live in their communities.
Thank you very much. Now, David Turton, CBC.
Thank you. Good morning, Mr. Singh. Pierre Poilievre said yesterday that people's biological clocks are running out faster than they can get money to buy a home. So we wanted to get your thoughts on this. Do you think it's appropriate for Poilievre to be invoking biological clocks and a woman's ability to get pregnant in this context?
I don't think any woman wants to hear Pierre Poilievre talking about their body, period. Period. Don't do it. That's the line there, folks.
Tell us your name.
Post that. En français, je ne pense qu'aucune femme veut que Pierre Poilievre parle de ses corps. Aucune femme veut ça.
Next question, your name and your media, please.
Wallace Snowden, CBC News. The NDP is up against some major challenges, no doubt, across the country in this election, expected to lose seats across many ridings, but experts are saying you may buck that trend in Alberta and in Edmonton specifically. So how are you expecting the vote to play out here, and also what are your ambitions for Edmonton? And if you could give the answer in English as well as français, s'il vous plaît.
For sure. Well, I can tell you, folks predicted in Ontario that the NDP was going to collapse entirely. They formed official opposition in Ontario, so I'm not worried about that. And here in Edmonton, people had counted out Blake Desjardins. They said, "Oh, no way Blake can win in Edmonton, Griesbach." Blake Desjardins beat a conservative. New Democrats beat conservatives. If you're worried about conservatives, in Edmonton, in Alberta, New Democrats beat conservatives. So I want to remind you of that. Donc, les sondages ont dit qu'en Ontario, que l'NPD va complètement perdre. Ils ont gagné l'opposition officielle en Ontario, donc je ne m'inquiète pas de ça. Mais ici, en Alberta, ici à Edmonton, les gens ont dit que Blake Desjardins ne peut pas gagner contre un conservateur. Blake Desjardins a gagné. Les néo-démocrates défient les conservateurs en Alberta. Donc, si vous voulez quelqu'un pour défaire un conservateur, votez pour l'NPD.
Merci. Next question. Tell us your name and your media, please.
Fleur Tamkobensi, Radio-Canada en Alberta. Ma question va rester albertaine. L'Alberta est la province qui a connu le plus de croissance de la population depuis les fédérales de 2021. Statistique Canada évalue à plus de 11% le taux de croissance dû à la migration interne, mais aussi à la migration internationale. Alors, On est dans un bastion, même comme vous venez de dire, vous pouvez défier les conservateurs. On reste dans un bastion conservateur. Comment est-ce que le NPD aujourd'hui adapte son discours pour aller chercher de potentiels nouveaux électeurs qui sont arrivés dans la province et qui s'intéressent aujourd'hui à véritablement vers qui est-ce qu'on doit aller? Quel est le nouveau message que vous utilisez pour aller chercher ces personnes-là?
De plus en plus des Albertains regardent ce que le Premier ministre conservateur Daniel Smith fait avec l'éducation, avec les soins de santé, et ils ne sont pas d'accord. Ils pensent que c'est la mauvaise chose à faire de couper dans l'éducation, parce que l'éducation, c'est la fondation d'une société. Ça, c'est l'avenir de nos enfants. Couper dans notre soin de santé, c'est de couper dans une valeur qui est chère aux Canadiens. L'idée qu'on prend soin les uns des autres. Donc, les Canadiens qui viennent ici en Alberta regardent ce que Daniel Smith fait et pensent non, ce n'est pas la bonne chose à faire. Donc, on donne une alternative, une vision d'un Canada où on prend soin les uns des autres. On a un système de santé fort. On a un système d'éducation où le gouvernement fédéral joue sa part et investit davantage dans nos universités et collèges. On a une société où on fait des investissements pour les gens, pas pour les milliardaires. Et ça, c'est notre offre aux gens en Alberta et à travers le pays. Yeah, for folks coming to Alberta, I think they see what Daniel Smith is doing and what the Conservatives are doing, cutting education, which is the foundation of a good society, the future of our kids, cutting healthcare, which is one of those values that Canadians hold dear. And they see Daniel Smith and Conservatives and say, you know, that's not what I believe in. I don't want that for my country. I don't want that type of Canada where you got to pay out of pocket to get care and only the richest get the best care and everyone else is left to suffer. I don't want that. And so we're saying to Albertans, well, you don't have to choose that. New Democrats beat Conservatives. New Democrats want to strengthen our healthcare, make it there for you and strong. We want to strengthen our public services and take care of each other. That's who we are as Canadians, and that's who New Democrats are.
Thank you. Next question, Daryl Greer, Canadian Press.
Just specific to this announcement, with the banning of American corporations trying to enter our healthcare space, we have here in Western Canada TELUS that has seen a void and introduced TELUS Health. So what about Canadian corporations who might try and enter the space and profit as you have just criticized?
Yeah, one of the things that we included in our announcement today is that as a condition of funding, a condition of federal funding, we're going to require provinces to crack down on cash for care. We believe in people getting access to care over the phone, over Zoom, over telecommunications. That's great. But we don't want people paying for it out of pocket. So we're going to require rules that crack down on cash for care, use the technology, increase access, but don't pay people for it or don't charge people for it.
Thank you. Last question, Edmonton Journal.
We're standing in a riding in Edmonton Centre that for 20 years has been a horse race between the Liberals and Conservatives. What chances do you see here of the NDP being able to, I guess, get into that race and maybe beat those candidates?
I see an incredible chance with Trisha Estabrooks as our candidate. She is a fighter. She is a fighter. She has shown you who she is. She was at the school board. You saw her fighting for students, fighting for families, fighting for parents, fighting for the education staff. You saw her conviction. You see what type of person Trisha Estabrooks is. She's going to bring that same fight to Ottawa to fight for the good people of Edmonton Centre every single day.
Thank you very much. That concludes the press conference. Merci
Thanks so
beaucoup.
much.
C'est ce qui conclut la
Thank you.
conférence de presse. Bonne
Thank you.
journée.
You guys are amazing.